I'm Dr. Sunita Rana Agarwal from Dr. Agarwal Hospitals, Bangalore. I'm an eye surgeon, but now I'm also into genetic research and using these sciences to treat a lot of patients. I'm very, very blessed and lucky to have been born into a family of doctors. Both my grandparents, doctors. Both my parents, doctors. One side Hindu, one side Muslim. So we have national secularism at its peak. No religion, yet a lot of love. With this, I charged forward into trying and treating various kinds of diseases that I could hear my parents and grandparents tell to their patients, okay, now there's not much we can do about your vision, but I'm writing some vitamins for you. Or there's nothing much I can do about you, but you can just go home. That was where I needed to change things. It was a burning desire to treat blindness, to treat debilitating diseases, to treat cancer. This set me onto a road which I had come to a conclusion way back in '89 when I was still studying in the US, that this could only be achieved by some kind of morphogenetic cell, pluripotent, totipotent, anypotent, but it could be achieved only from the biological process. In my simple mind, it had come to the conclusion, whatever pharmaceutical product we use, it will treat the condition and it will also give some side effects. Therefore, its limitations, and therefore it cannot go to treat higher diseases and incontrollable diseases. Thus, I've marched forward. I did so many experiments from 1989 onwards. I took rabbits, I put fetal stem cells of the rabbit into the cut optic nerve of the rabbit. It grew. I did a lot more. I pushed in so many experiments in the next 20 years that it set me thinking that now I have this fetal stem cell. Maybe rabbit, maybe anything, that's not the point. How do I keep them alive? To keep them alive, I went into the road of producing a culture medium. That culture medium now became something fantastic, because when we saw this under the microscope, that culture medium we called MANA, morphogenetic activator of nucleic acids. This MANA was able to transform the adult cell into a stem cell, and in the matrix was able to bring in DNA. Much later, with a lot of our scientific validations, we understood that this is DNA, this is a fetal stem cell. These studies were done in various organizations and laboratories, one of them being Eurofence and Max Planck Institute in Munich, the Indian Institute of Science, the Defense Research Development Organization. There were so many. I'm so thankful to all those laboratories for letting me come into their labs, use their space, and show you what we have so far. How did this come about? Why am I calling it morphogenetic? There is morphogenesis. Morpho means structure. Genesis means creation. Through the structure, it's creating. This field is very important. Inside of that field, it will create those kind of things which it has been morphogenetically controlled for. Now, this activation we can do and thus activate the nucleic acids which is already present in your plasma. With a lot of studies that we did carry out, I didn't know at that point of time that this DNA was what we were doing, because we could see cells and the cells were turning into stem cells. We were convinced it was stem cells. When we went to the DRDO laboratories, they showed us, no, it's not only the stem cells, it is the matrix which is seeing DNA. And this DNA is far bigger, far more beautiful, and thus, with our studies in Munich, we were able to prove that this was of fetal origin, but it came from the same patient. So the blood of an aged person, when mixed with manna, will create the fetal DNA of that same patient. These facts were easily collaborated with us. This moved us even further, and thus we made a statement that we could now create DNA. No, that's not how it is. The DNA is already present in the blood of the patient. However minuscule, it is there. In morphogenetic activator of nucleic acids, there is no DNA at all. This we call manna, no DNA. Plasma of the patient present with DNA. When you mix these two, you see a bubble with DNA coming alive. It took us more than 1 week to get that video. And over and above that, when these two fields mix, that is the blood of the patient and manna, somewhere in between starts a very high energy ball. That energy ball goes into the center and then starts bringing out stem cells. What you're seeing in front of you is actually how it happened in real time. There is no stain used. You can see the multi-colors of the Vibgeo. You can see the halo around every cell that is being created by that high energy ball that came into existence when blood of the patient met with manna. Now this is what we were doing, and we started now using this on patients. In 2004, I lost my father-in-law for cancer. A long time he was going on telling me, use this on me. At that time, I was only on animal experiments, so we would inject the paw of a mice with formaldehyde, another batch of mice with formaldehyde, treat them with non-steroidal anti-inflammatories. Third batch, formaldehyde, treat them with peritoneal manna injection. These two batches of mice stopped scratching their paws within 15 minutes. The first batch just continued for more than 24 hours. All these experiments is what we were doing in trying to prove the efficacy of manna in not at that time just being a morphogenetic activator, but also working as an anti-inflammatory, antipyretic, and all these conditions that we knew it was already treating. Thus started a huge, big 18,000 patients that we could treat in these last 15 years. In this, each patient gets a minimum of 10 injections. So we take 1 drop of blood from the finger, mix it with manna, and re-inject it into the patient. With our studies at the Indian Institute of Science and the Jawaharlal Institute, we were able to prove that the DNA is being formed in less than 1 second. They have this wonderful camera which can take pictures of 125 frames in 1 second. And before we knew, it was already creating the DNA. So we had to be very, very sure about our focus. This set us again that we can do this immediately. Thus, we take the drop of blood, mix it with manna, and within 5 minutes, we have given it back as a subcutaneous injection to the patient. Here now we could treat congenital diseases. We are not curing anything, but yes, we can definitely make the patient better. Whether it is retinitis pigmentosa, diabetes, hypertension, thyroid, be it what you may, it will treat. This morphogenetic activation has now been awarded a CSIRO recognition from the Department of Science and Technology, where is considered as a scientific industrial research organization, and that moves us forward in trying to bring this to the public in what we want to do as a commercialization. At this point of time, I can do a very limited amount because I have to be very, very tight about the quality control and only inside my premises. However, once it goes in for commercial, then we can go and cover every city of this globe. Thank you.